So Matt's just poured me a lovely cup of tea here, and we're going to talk about an article I saw in the paper on the weekend, which was the state governments in Australia are all massively in debt, and that level of debt is growing by the year. We've got two governments up for election this year in New South Wales and Victoria, the two biggest states in Australia. So both of those new governments that come in after those elections will see reducing that debt as a necessity, because if it carries on at its current level of trajectory, 10% of state governments are going to be spent on paying or servicing interest payments. That's obviously unsustainable. But if you want to cut the services to reduce that expenditure, that's going to be politically unpopular. We saw a government turfed out in Queensland that did that very dramatically a few years ago. So what you've got to see is how can we maintain service levels at less expense? And that gets me to the proposition, Matt. We talked last time about AI washing, where people were saying AI's going to do all these wonderful things for us. But surely we can look at the fiscal challenges of state governments and say, how can AI optimize and make the services they do more efficient? And Matt, I'm going to say to you, there are two big areas in every state government expenditure. 30% spent on health, 20% spent on education. How do you see AI can help the delivery of health services and cut that expenditure that we need to make, but still maintain service levels?
Mm-hmm. Yeah, I think it's a really interesting topic, Peter, at the end of the day, because when you look across education, health particularly, and I'm not going to be sort of dumb it down too much, but when we talk about some of the true benefits or values from AI, always sort of comes back to improving productivity. So reducing repetitive, mundane tasks and workloads, driving greater efficiencies of how we use our time, not necessarily making massive transformations of those environments. Mm-hmm. And I think within healthcare, just use the GP for an example. I know GPs are starting to leverage AI a bit more now in their sort of rooms when they're meeting with patients. So I was asked the other day, do you mind if I record this, using ChatGPT or whatever for reference? And I'm like, yeah, sure, fine, that's okay.
But let's stop why that person is saying that to you, Matt. They're saying it to because in the old days, as soon as you left the waiting room or their surgery, they'd have to spend 15, 20 minutes documenting all that sort of dialogue they've had with you to maintain the record for you. Exactly. And that's lost time for them.
It is, that's right. And I think particularly in this current environment, I would hazard a guess, unless you're a very highly paid specialist, even in that case, most doctors do not have time to do any of that because it's back-to-back appointments. You can go to any medical centre and book an appointment, and they're 15 minutes. But then also, to your point, when they're capturing some of those conversations afterwards, even if it's just 2 minutes, that flow-on effect throughout the day leads to massive delays. So you're absolutely right. And I think that one of the things I would also say is I think while there's obviously, I think, been some resistance in sort of health circles around AI, and that it might replace our jobs and take away what we do, our value, that sort of thing, I would counter that by saying that AI is one of those technologies, whether it's through note-taking as you talk to a patient, whether it's kind of assessing multiple range of symptoms across a person to come up with some other conclusions. I think it will save time, and I think it will save money as well.
If you look at the evidence, the research, I should say, the health service is short of people. I think there's an occupancy rate is about 68%, so they can't get the people they need for the jobs. So we need to look at technology to augment their work so we can free them so that they can focus on the high value stuff.
We do, and to drive better outcomes for patients as well. Because again, when you start looking at AI, and again, we're not going to put everything in there, and there's a lot of patient safety and all that kind of stuff and privacy, but you can guarantee that if Mr. or Mrs. patient A and B walks into a doctor's surgery and says, I've got this, and the doctor thinks, oh, hang on a minute, let me go through my checklist of things I should consider that is. If you put those 5 into an LLM, there's going to be one person out there in the world, or whatever, in Australia, who's had exactly the same symptoms and had a particular outcome. And I think that's the benefit that can help doctors, but ultimately help patients as well.
Well, and let's look at that, Matt, because what you're saying is the diagnosis of that person's problems can be done much more quickly. And so if it wasn't done quickly, a lot of time would be spent trying to analyze what the problem could be, which is downtime for the surgeon.
Forget the surgeon, that leads to poor patient outcomes.
At
the end of the day.
So the clinician's time servicing that person is not looking for what the problem is. It's getting to understand it more immediately and being able to then prioritize their time in servicing them.
Exactly. So even if you don't understand what it is, it might change the way you approach looking for what it could be.
Yeah,
I think it's probably more important. A good friend of mine, I'm not going to name names, that happened where, you have certain symptoms, but the doctor, we always go through a checklist. We'll try this, we'll try this, we'll try this, we'll try this. So my point is that perhaps leveraging AI, it might actually, let's just flick the checklist around. Maybe start here instead of here this time.
Yeah.
That sort of thing, ultimately. So it's helping the doctor analyze what the not just what the ailment is, but how to approach identifying what the ailment is. I think that's kind of one of the areas which, again, to your point, saves clinicians a lot of time, saves the patient a lot more angst, leads to better outcomes, and ultimately, Peter, coming back to your budget question, it reduces the burden on the state budget because we're not spending so much time going through tests and tasks which aren't necessarily relevant.
And so we can do it with perhaps more optimal workforce. We don't have to have that workforce scattered because we're inefficient. If we can optimize people's times, we can make them be more productive. We can manage our budget effectively. But it requires, getting back to that AI washing, it requires us to have vision.
It does.
Because it requires us to see how can we AI enable the health service, in the public health service in Australia, so we can provide those efficiencies that we get from AI.
And think about Australia as well. Like for a very large degree of the population, obviously we're here in Mittagong, we're kind of pretty blessed around the Southern Highlands with how many doctors we've got available if we need them. Right? Yes, it's hard to get a new doctor, but we can get access to a doctor. I could probably get an appointment this afternoon, right? If I need to with a doctor. But then you get out into rural, remote parts of Australia and you start getting these like telehealth booths, if you like. I think it's Fujitsu. It's kind of setting these up around Australia, where you basically you turn up, you present yourself, camera, kind of you let in, sit down with a screen. You then might put in what your problems are. The doctor will be on the other end. Then basically it will then open up a cabinet and say, right, you need to take some of this or some of that. I'm kind of dumbing it right down, but essentially what this is where things like AI can kind of potentially kind of identify what the problem might be, then put that person in touch with the right health professional who could be in Darwin, wherever they might be. And there's other things, when you think about a good friend and colleague of mine, Mike Harris, and his wife, they've done a thing in the US around pancreatic cancer, for example. And what they're doing there is that for most patients, we have no idea where all the various sort of trials are happening and the tests are happening, all that kind of stuff. But they're really leveraging technology to distill down where everything is happening across the United States and pairing patients based on their particular challenges with the right trials, right? And that's not having a patient conversation. That's algorithms and that's AI, and that's matching them to the right place so that people get access to the right sort of capabilities.
So they can be more effective, they can be more productive. I had a similar conversation with Peter O'Halloran, who runs the Australian Health Digital Agency. He's the CIO there. And he was talking to me about breast cancer. And Australia has a very long-established mammogram service that it provides in communities. It goes in communities, offers women tests on their breasts to see if there's any risk of cancer. But you end up with having 1,000 scans done, and the clinicians have to go through those 1,000 to find which ones have got the problems. Well, if you've got AI could help triage that for the clinicians by identifying, you should probably look at this one or that one or this one. It just makes their time more effective.
It does. And also, you got, we had the old sort of term Dr. Google, right? Now we've got Dr. Copilot. So I hurt my ribs, I won't go the story, like a couple of weeks ago. And
it's a good story.
just let me say, falling into a swimming pool in the Southern Highlands in the middle of June is not a good idea.
Yes.
But anyway, so but the point there is, so I was on Copilot. I kind of put in symptoms and all that, basically told me what the problem was, and I kind of knew it was because I've had it before. So I didn't go to the doctor. I did in the end because my wife told me to. But the point here is that I'm not saying that it will replace the doctor.
Yeah.
But doctors need to be aware that that's what their patients are doing before they come there.
Yeah.
So it's not to be presented with, I know this is what the problem is.
Yeah.
But it's accepting that you're going to have some higher level of knowledge and understanding of what potentially their ailment is before they walk in the room. So doctors leveraging AI, Copilot, ChatGPT, whatever, is ultimately going to empower them to be ready for the conversations they're likely going to have with their patients as well.
Well, we've talked about health. I'm going to talk about education because two of my siblings are teachers. And I am astounded the amount of bureaucracy that teachers have to do. If there is a child with special needs in a class, they have to do an assessment after every class with that child of how that child behaved, and that's so time consuming for people. And so, and I know there's a lot of pushback in the teaching profession about this sort of amount of paperwork that they have to do. AI is going to be one of the ways that they can do that. And we get burnout in teachers, we get burnout in health. And part of the reason for the burnout is this administrative load that we put on people. If we can free them, we're going to get more effective use of those sort of frontline staff.
Absolutely. I think that's you nailed it there with the repetitive sort of admin tasks that they have. You see that across a lot of organisations as well, not just within education, Peter.
Yeah.
But we need to free our teaching professionals up to focus on teaching.
Exactly.
At the end of the day, all right?
Exactly.
We talk about
that's why they join the industry.
So it's kind of talking about freeing people up from the mundane to focus on value, and that's no more sort of pertinent than ever than in the educational sector. And also at the end of the day, helping support frontline staff decisions as well. In terms of when they are sort of assessing the kids and that kind of thing. Where are other examples? What's worked? What hasn't worked?
Well, and that's part of it as well, Matt, because I'm seeing what my sister talks to me about is you should be able to identify a kid that's got problems. There's certain behaviours. You can start to see outliers in some of your classroom in the behaviour, and there may be things happening behind the scenes that you need to address that helps that child. And if you're not aware of that, the child then becomes a problem child and a cost to the sort of overall school. But if you can actually help an early intervention for some of these problem areas, you benefit the child, you benefit the teacher, and you save money.
Yep. And that's exactly a similar thing to what we talked about with health, Peter.
Yeah.
It's that kind of predictive analytics in many ways, leveraging AI to make the right predictions and having better outcomes for the student, for the patient, but also for the teacher as well. I mean, if you can help the teacher not just sort of get ahead of all this admin tasks they've got to do, but help the teacher make informed decisions early on, then their life as a teacher is going to be much more rewarding and enriching as well.
Well, and there's a lot of work in that, Matt, for the average teacher. I mean, we're dealing with subjects that are constantly evolving. There's such a dynamic element in teaching that didn't exist, I think, in my childhood, where you could have fairly predictable subjects. They've got to evolve and change subjects to deal with the impact of things like technology. And the use of technology to help them prepare is, I think, one of the ways that we can optimize their time and make them feel more productive in what they do.
I do, and I think that does have to be done also, not necessarily the very young students, but I think that needs to be done in collaboration with students as well, because that's obviously that's the next generation coming through, and they're going to face a different need than what the current generations have as well. So I think there's a great opportunity here to really lean into the next generations in the school environment to consider what is it they're going to need in the future.
Yeah.
So how can we help ensure as we educate them to prepare them for what's coming in the future as well? Because as we've talked about, what we're seeing now with AI, what we're seeing now with things like Claude Mythos, what we're seeing now with potentially with quantum coming down the track, what we're dealing with today is going to be nothing compared to what's coming in 5 years. And that's, again, coming back to the conversation I had with William McMillan, the ex-CISO at the CIO. He said, if you're not prepared now for quantum, it's almost too late.
That's going to take you time. That's right. So we're going to talk about quantum next, I think.
Thank you very much.